morning, everybody. My name is Jon Lane. I'm one of the independent directors of the Toilet Board Coalition, and I'm between you and your coffee break. The TBC journey, we've heard a lot about that. The TBC journey and indeed the sanitation economy concept as a whole are parts of a much larger story, a story about sanitation overall. And a major milestone in that story was the International Year of Sanitation in 2008. Now, today's theme is sanitation as a solutions provider. And in the International Year of Sanitation, that's what we were doing. We were promoting sanitation as a solution provider to politicians. And in honor of the year, I'm wearing a piece. This is a wearable advocacy message from International Year of Sanitation. Hurry up, 2.6 billion people want to use the toilet. We used to see Ronnie Casseroles wearing these the whole time. Now, one of the 5 key messages of the International Year, in fact, the first of the 5 messages, was that sanitation improves health. And so that's one element. The second element that we're bringing in this panel is that the really big political breakthrough that's happened since the International Year was the recognition of sanitation as a human right. And that was a recognition by the UN General Assembly itself. So this panel is going to be presenting to you some very exciting innovations in health within the context of sanitation as a human right. We've got a very short amount of time for each of our presenters to present to you, and the aim here is that you can identify these people, you can get to know them, and then come and talk to them one-to-one in the coffee breaks, in the lunch breaks. So this is rapid fire introduction from a group of fantastic people. First of all, I want to ask Amanda, this is Amanda Loeffen from WATERLEX, to set the scene. My question to you, Amanda, is that we're aware that the responsibility to realize the human right to sanitation does not only lie with governments. It lies with everybody, including service providers. So please tell us about a tool that you've developed which is helping small-scale service providers to comply with their responsibility for the human right to sanitation and also to gain a competitive advantage. Amanda.
Thank you. Good morning. So the human right to sanitation is an international binding norm. The obligation is to protect, respect, and realize these human rights, and it's not just for governments. Business suppliers are also duty bearers. It's not just a nice to have, but it also makes good business sense. So what is the human right to sanitation and a human rights-based approach? The slide above gives you a little bit of an overview of the 5 criteria and principles behind the human rights to sanitation and how they connect with SDG 6. So a lot of people are not very sure what it means. It's a bit nebulous. It's difficult to realize and it's quite complex. So we've developed a checklist, a kind of tool that's a methodology and a step-by-step guide. It's available on our website. It's freely available. Obviously, we can help advise you if you need some help. And it includes how to address the needs of the most vulnerable people. So what's the business case? One of the hardest parts of scaling up is getting the funds to realize economies of scale. And there are 4 ways that taking this human rights-based approach can help. One is that it helps local government to trust the private sector. Number 2 is it lowers the risk of investment if the government is supportive, either with regulations or with subsidies, for example. Number 3, it creates a high level of standard which protects your investment. And number 4, and probably the most importantly, is that it provides a service that people actually want. So, not only does the human rights to sanitation create a demand for your service, it also lowers the risk and potentially protects your investment. It's absolutely essential for realizing government targets on SDG 6.2 and for enabling all vulnerable people and groups to have access to safe and sustainable sanitation. So on the left is a little example of one of the pages from the checklist. It's very simple. As I said, it's freely available on our website, but please have a chat with me if you'd like to know more about it.
Great, thank you very much. So please do come and see Amanda later in order to find out more. I think it's absolutely fascinating to see how achieving a human right actually can help you in your business to be more successful as a business. Tremendous, thank you very much. Now I'm moving on to our friends who are going to be giving us some quick snapshots of work they're doing that is related to health within the context of sanitation as a solution provider. Let me start with Ashwin. Ashwin Naik from Healthcare GameChangers. You work principally on hospitals, but tell us a bit about healthcare beyond the hospital, Ashwin.
Yeah, let me start with a little bit of conversation we had in the morning with Noriko. I was explaining what we do, which is we set up hospitals and run hospitals in small towns. And her question was, what do you have to do with sanitation? And I told her nothing. And this is really a problem and also an opportunity, because clearly the private healthcare sector is excluded from this conversation in many, many ways. And the reason I'm involved in this is a few years ago I started looking at what are the new models in healthcare emerging which could transform the healthcare sector. And one of the key learnings for me was we have to think outside the hospital. Nothing innovative is happening within the four walls of the hospital. And my journey took me to various players around the world. And maybe I can share one interesting story from Brazil, an organization called Saúde Criança, which primarily works with young children. And the way the organization is structured is if a family comes with a sick child, they send somebody with that family back to their home. And the person who goes back does 4 or 5 things. One is they check what is the sanitation structure, what kind of jobs do they have, what kind of rights issues are they facing, because jobs, livelihood is a very big indicator or very big predictor of good health. So they do 3 or 4 things, and the organization then works with this family over 2 years in fixing those problems. I think those are the kind of approaches that the healthcare sector needs to engage in. And it also has a big downstream impact on the industry itself, particularly for young children and malnutrition, which is interlinked with sanitation. So I think checklists like this, where we can engage not only the public health infrastructure, but also private sector. In the context of countries like India, 70% of our healthcare delivery is done by private players. So this is a great way for us, all of us, to get involved in this conversation. Thank you.
Thanks a lot, Ashwin. A fascinating example from Brazil. That was terrific. Thanks. And also, as a general point, please come and talk to Ashwin afterwards, because there's a lot of really complex issues there in the relationship between healthcare institutions and, as you were saying, in hospital. Maybe there's less innovation going on within hospitals than we would want to see, but also the acknowledgement that people in the healthcare industry want to come and meet sanitation people and learn from us about new things that we're doing that can then be incorporated within healthcare as a whole. So that's a really exciting invitation to collaborate. Thank you very much for that. Let me move on to Neeraj. Neeraj Jain from PATH. Tell us, please, we know PATH, really prestigious organization. Tell us about some of your innovations in healthcare relating to this issue of sanitation as a solution provider.
Thank you. Well, firstly, I'm really happy to be here because I don't know if you guys know, but I used to lead WaterAid India for about 3 years when the Swachh Bharat mission started. And then I moved to PATH, so from water and sanitation to healthcare. So it's been an interesting transition for me. And I remember when I was at WaterAid and we used to talk about wash in health, that was a separate topic. But I'm glad to see that it's getting integrated and we are actually moving in that direction. You know, if you think about, and you've got a nice blurb there on preventative health, and actually sanitation is the big one. So if we are able to really take care of sanitation, you probably don't need too many public health experts out there. For Path, we look at it from another perspective in the preventative space, which is vaccines. So, you know, we've been part of developing 2 rotavirus vaccines out of India, which hopefully will take care of about 70% of the child deaths from the rotavirus that we are facing in India, and probably about 300,000 children across the world. So that's a big one. But ideally, we should not need the vaccine. Ideally, we should be living in a world where sanitation is perfect and we don't need the vaccine. Coming to the rights aspect, I won't talk about the right to sanitation because I think we've already heard lots about it. But really what we are moving into is from SDG 6 to SDG 3 and right to health, universal health coverage, and that is a critical part, and sanitation is a critical part of that. You know, while you may see it as a separate SDG, but without SDG 6, SDG 3 is just not going to be possible. So that's an important thing to remember. Within that space, you know, Ashwin talked about hospitals, etc. I think where our focus is in Path is really around primary healthcare, and how do we make sure that we get down to that last, you know, member of the family living in a rural village which is hard to reach. And the challenge of India per se, and since I lead the program for Path in India, I'll focus on that. The challenge for India is we've got a large population. I mean, we have 1.3 billion people and growing. We're spread across the country. We've got a challenge where we don't have enough trained manpower. So we've got healthcare workers who have probably just cleared their grade 10, and you know they're struggling to reach the population. What we need to work towards is how do we empower these healthcare workers with digital solutions, maybe artificial intelligence based, maybe wearable technologies, etc. How do you ensure that the screening of the population is happening for good health? And that's really the space that Path has been doing a lot of work on and thinking about population health. In fact, with the Toilet Board Coalition, we've been having conversations about, you know, can we look at you know, testing excreta and figuring out whether there's a population level health hazard that we're facing. You know, is there a cholera outbreak or things like that? But what we're doing currently with Path, I can tell you a few of the examples. Screening for tuberculosis. We are using artificial intelligence, mobile phone, through the X-ray, and ensuring that you can actually screen one person every 30 seconds to be able to check whether they need to go for further checkup or they're free of TB. We are looking at artificial intelligence for measurement of weight and height through a mobile phone, again, a camera. You take a photograph, and that image is then looked at through the machine, and you're able to determine the height and the weight and of the child. We're looking at lots of wearable technology for pregnant women. In India, we have a large maternal mortality rate and also a large neonatal mortality rate. So wearable technologies for the mother, for the child, which would definitely help the population. So, you know, I think while it's great to talk about right for sanitation by itself, I just want to say that this is connected to right for universal health coverage, and we should all be working towards that. And I'd request the audience to also think in that direction.
Thanks a lot, Neeraj. Absolutely fascinating. And it's great to see a colleague who has worked previously in the water and sanitation sector and is now more broadly working in primary health care, and this is a fantastic connection. I thought some of your examples there of the application of technology, of AI and mobile phones, in your case to TB or maternal and childcare, are really fascinating. And there are people in this room who I've spoken to in the last couple of days who are providing, let's say, software platforms and apps that would fit in precisely with what you're talking about. So I think we in sanitation should be learning from some of those things that Neeraj is talking about. That was great. And I loved your emphasis on empowering the healthcare workers, that the function of the technology is not to take over, but it's to empower the people, and ultimately that they are serving the poorest and most neglected members of your society. And that ties in precisely with the theme of leaving no one behind, which, as you know, is the United Nations UN Water theme for water and sanitation for this year. So that was great stuff. Thank you very much. I'm moving on to Ankur. Ankur Kaul from Philips. Philips is a household name. It's one of the most famous consumer goods and electrical manufacturing and supply companies in the world. I'm absolutely thrilled to find a representative of Philips here with us in Toilet Board Coalition. You know, this is great. And I'm keen to hear from you some examples about Philips's work in digital health and in access to primary care. Ankur.
Thanks for that, and thanks for the opportunity. So I also have Ajit with me, another colleague from Philips, and I think Philips in India at least is known for the old radios. Some of you probably still have them at home, right? And even within my family and my relatives, I often get asked, so you still make the radios, right? So I was like, well, Philips has been on a 125-year journey, and we've transformed the company into a health tech company, right? And that's really the focus for Philips. We are sort of all eggs in one basket, so to say now, you know. And where we come from and how this is relevant is that Philips is driven by a vision of improving 3 billion lives by 2030. That's what we are all striving for. And within that 3 billion, we have a sub-target of improving 400 million lives in the underserved regions in the world, with a focus on countries in Africa and Southeast Asia, right? And as we all know, and I think Neeraj pointed this out, Ashwin pointed this out, that access to care is a huge problem in some of these countries today. And we as a health tech company are doing our bit to help fix that. And I think we have two main insights, been on this journey for last 7 or 8 years now in the primary care space, is that two ways that we feel that we can really address the problem of access to care is, one is by strengthening primary care delivery. Primary care is the first point of contact for any patient with the health system. In many of these countries, this system is broken today. What tends to happen is that people tend to go to a secondary or a tertiary care hospital for even ailments that can be treated at a primary care level. So it's very important that we fix that. And the other insight that we have is that no one person or no one company can do this alone. It has to be a collaborative approach, right? And the example of this is on this stage right now. So I'm working very closely with Neeraj's team in Path to see how Philips solutions can be used in primary care. Ashwin and I were on a panel about a month ago advocating the need to strengthen primary care, right? So just here, there is collaboration happening right now. And one of the solutions that we have in this space is what we call as a community life center. These are essentially primary care center, fully functioning primary care centers that we set up, but we offer a range of services. So starting from infrastructure, from solar power, water treatment, waste management, sanitation, and this is where the connect with Cheryl and her team comes through, is how do we get these community life centers to be a clean place for women and children to come in to get healthcare services. We offer a lot of digital solutions with focus on mother and child care, and Neeraj spoke about this, the problem of maternal and infant mortality. We have a digital solution for detecting high-risk pregnancies early. And also we have solutions for chronic diseases like diabetes and hypertension. And then we also do a lot in community outreach. So the whole theme of empowering the community health workers through mHealth, mobile health-based solutions, taking care outside of the traditional hospitals and into the homes of these women and children is something that we do. And a lot of these community life centers today exist in Africa because we started there. So we are present in Kenya, South Africa, Congo, Brazzaville. Slowly we are expanding this to Southeast Asia. And we've already had fantastic impact. In the last 7 years, we've seen high-risk detection go up 3-fold in some of our centers with the use of these technologies. We've seen meaningful referrals being driven from primary to secondary care. So I think it's a very rewarding journey to be part of, and we need everybody here to be part of that journey to make access to health possible for all. Thank you.
Thank you very much, Ankur. My mum had a Philips radio, and she'd have been really thrilled to hear that Philips is now a healthcare company. And next time we meet, I want to hear you saying, Philips is a sanitation company. Now, that was really interesting, and I was extremely impressed by the scale at which you're going to be operating. We've been talking about it this week. There are a lot of people in the room here who are tremendously energetic and brilliant entrepreneurs just setting out on the beginning of that long pathway. And here we have Philips, 100 and something years old, and they're just talking about reaching 400 million people in some of the poorest countries of the world. Now, how inspiring is that? That is just great stuff. It's a thrill to have you with us. I'm moving on to our final member of the panel, Noriko Endo from BIOBOT. Could you tell us, please, about one or two really exciting things that you're doing at BIOBOT that are commercial ideas that relate to sanitation? Noriko.
Yeah, sure. Thanks, Jon, and thanks everybody for providing me this opportunity. As compared to Philips, we are only 2 years old, young company. So let me start with talking a little bit about our company, what we do, what we experience, and we learn through this journey. So we are BIOBOT Analytics. We are the first company in the world to commercialize wastewater analysis for the purpose of public health. So urine and stool have lots of information of public health, right? Or your health, your health. And those information is actually aggregated and sitting on top in public sewers and community septic tanks. So our mission is really to transform those wastewater infrastructure into public health observatories. So I want to point out a few things that we learned. So one is really to make sure that it is really important to make sure that our data is meaningful and actionable to stakeholders in the communities. So we have some conversation in, say, in the US, Canada, Australia, Nepal, and India. And obviously, every country have different interests, right? Some countries are interested in consumption of prescription drug or illicit drug. Some are more interested in spread of infectious diseases or antimicrobial resistance. So we need to understand what people are interested in, knowing from wastewater samples. And also interestingly, when I speak with, say, public health officers, educators, firefighters, we are finding that those people have different interests or different perspectives of the problem, even in the same community, right? So to really use our data, the wastewater data, to transform into actionable data, we really have to to bring all the stakeholders in the same table and have intensive conversation. So that's one thing. Another thing that I want to speak about is to make sure that everybody's voice is represented in our data, and I think it resonates with Amanda's slide. And I also think that this sanitation economy framework really helps in two ways. One is by accelerating having infrastructure in a way that our data can represent everybody's voice. Say if the poor people in slum don't have access to toilet, there's no way that we can get data to have their voice in it. So yeah, having that is really important. And also I want to echo, and lastly I want to echo what Ashwin said. We need to stop acting reactively, but we have to start acting proactively using the data from wastewater.
Great, thanks very much, Noriko. And I mean, that's a wonderful, very specific, tangible example of how sanitation can generate data that can be used for healthcare provision and health management. This is something the TBC is very keen on, and I think it's fitted in really well with some of the points that our other colleagues have made. So thank you very much for that. So I told you that was going to be a very rapid introduction. Time is against us. but at least you've had the chance to meet these 5 people, and then you can talk to them during the next day or two. Now, don't move, okay? This is not an invitation to sneak off to the coffee break, because I'm going to hand over back to Sandy, and he's going to explain to you about what we're going to be doing over the next part of the day. Panelists, let's just stay here. I'll come and join you, and then we'll pass over to Sandy. And indeed Alex, who, as you probably already know, is the person that actually runs this entire organisation. And Alex is going to tell us
right, John.
what we're going to do next. So thank you very much. Big applause for my panel, please.